Through its advocacy efforts, ASH has brought issues important to the field of hematology to the attention of the U.S. Congress and federal agencies. The Grassroots Network Lunch provides a forum for members to learn how they can participate in these efforts. This year's lunch featured keynote speaker Dr. Rochelle Walensky, director of the Centers for Disease Control and Prevention, who discussed efforts by the CDC to address health disparities and racism as a threat to the nation's health.
I think if we have a public health infrastructure that that is as diverse as the communities that it serves, that all of the ships will rise, essentially, that you will have more people having blood pressure checks and more people having access to health care. And in fact, we want to streamline that access to health care so that when you have access to even things that are rare, niches of medicine, that access can be much more fluid.
Speaking of advocacy, a new bill was introduced in Congress on Thursday, thanks in large part to ASH's efforts to educate legislatures on the issue of lack of quality care for individuals living with sickle cell disease. The Sickle Cell Disease Comprehensive Care Act is designed to improve access to high-quality, comprehensive outpatient care for people with sickle cell disease who are enrolled in Medicare. We learned more about this new legislation from the leadership of the ASH Committee on Government Affairs.
So it's going to start in some of the original 11 states where the data collection program was going, and it will allow for additional staff to try and make sure that we make outpatient care comprehensive and really organize the kind of care that sickle cell patients need. Sickle cell disease can affect a lot of different organs. It certainly puts the patients in contact with the inpatient and outpatient suites commonly, and their care is better performed if we know exactly what best practices are.
Data shows that about 50% of individuals with sickle cell disease in the United States are covered by Medicaid. So Medicaid is the primary source of health insurance for these people, and we need higher quality care in order to improve outcomes, and the best way to do that is through federal legislation.